If anybody joins late, I'll let them in anyways, so that's okay. All right, here we go. Good afternoon. Thank you for joining us for this week's weekly Wednesday presentation on the Wonders of Hospice. This presentation is being recorded and will be uploaded to the Otsego County Office for the Aging Facebook page and to our county website. I ask that everyone except the presenter and myself to keep your videos turned off and that you remain muted unless you have a question. Please feel free to unmute yourself and ask your questions as we move through the presentation. You can also use the chat feature if you prefer, and I will ask the questions for you. My name is Alicia Chase. I'm Otsego County's long-term care coordinator. I supervise the Otsego County New York Connects program, and for those who are not familiar, New York Connects is the connection for all long-term services and supports. While my office is under Office for the Aging, we are unique in that we are able to help anyone of any age who is looking for help navigating the complicated long-term care system. We can help friends, families, caregivers, and clients who are looking for information and assistance, referrals, and application assistance. If you're unsure, please do not hesitate to reach out. And we also have a New York Connects partner with the Independent Living Center. My contact can be found in the chat, and for those of you calling in on the phone, you can reach me by calling Office for the Aging at 547-4232. At this time, I will turn the program over to Kelly McGraw with Helios Care for today's presentation.
All righty. Thank you so much, Alicia.
You're welcome.
Yeah, it's always our pleasure to do these types of chats, educational program for our community members. We call it the Wonders of Hospice and Palliative Care because what we really like to run through with folks is sort of the who, what, why, where, and when of hospice and palliative care. What we call it sort of the everything you ever wondered about hospice. And there's a couple of reasons why we like to provide these types of chats. One is because we do understand that there's still a lot about hospice and palliative care that people maybe really didn't know or don't understand. When it comes to understanding what hospice is or what hospice isn't. And we realize too that sometimes those unknowns, or maybe even another way to look at it is some of the common maybe misconceptions or myths that might exist or that are out there that are quite common actually, that might actually be preventing people from really getting the best care possible when they need it most, which for most folks, when we talk about the best care possible when they need it most, we're talking about much earlier in their disease process than one might think when they think of hospice. And not only are we looking to help people understand hospice so that they can get the best care possible when they need it most, which for most is sooner, but also to think about it as the best care possible where they need it most, or where they would prefer to have the type of care we provide the most, which is for most people at home. When we talk to many people and surveys that have been done across America, really, when you talk about where you want to spend your final days, months, what have you of life, most people would say they want to be home and comfortable and surrounded with their loved ones, families, friends. So this education is meant to provide people with more knowledge and education about how that might be possible. So let me just start out by sharing with you sort of the who. Okay, there we go. So this is a little bit about the who we are when we as Helios Care and as providers of care in the community. because this is our mission statement. Our goal is to make life easier for patients and families facing a serious illness or end of life by providing choices, dignity, and compassionate care. When I mentioned some of the common myths, misconceptions, is when people hear the word hospice or they think of hospice care, obviously they're thinking about death or the active dying process. Notice in our mission that our approach to care is more about life and making life easier for not only the patient, but their families. We see them as an entire unit that we're caring for. So it's all about making sure that patients understand their choices available to them and they get the kind of care they want and need, which usually involves making sure that they're treated with dignity and respect. So a little bit as to the why people are choosing Helios Care is because of the type of care we provide, which can be somewhat unique when you think of the hospice philosophy or the approach to care, which is emphasizing comfort and quality of life. Like I mentioned earlier, ideally at home or wherever the patient calls home. And again, I can't emphasize enough those two words, comfort and quality of life. And when we look at those two elements, we're emphasizing or trying to promote not only the physical aspects, making sure they're comfortable physically, but also emotionally and spiritually. As it says here, you know, you kind of think of that as that holistic approach that some people might hear of. So we're looking at the whole person, not just the disease and the symptoms. So we're treating people sort of mind, body, and spirit. And what's unique about that is that our care is also delivered through an interdisciplinary team. So it's very much a team-oriented approach. And the patient and family are considered a part of the team. So throughout the whole process, in order for us to make sure that we are addressing comfort and quality of life, we have to involve the patient and the family in that plan. So a lot of it is empowering those patients and families, providing them with the education, helping them to understand their choices, making sure that they're actively involved in developing their plan of care so that they get to stay in control. Or another way to look at it is they get to call the shots, so that ultimately everyone starts to feel better, thus live better. And again, when I mentioned that, and when I say home, we mean that the care we provided is in the home or wherever that patient may call home, whether that be a nursing home or an adult home. Okay? So when I mentioned earlier about addressing some of the common myths, I just want to put that out there because we still hear from time to time, believe it or not, when people hear the word hospice, they're thinking of cancer patients. And while hospice was founded in this country, you know, a couple decades ago and was geared more towards those with cancer, you can see here from our little chart that I've shared with you that to date, probably a little over a third of our patients do have some form of cancer as their terminal illness or disease. But you can see we serve quite a few patients with other types of diseases or maybe even multiple comorbidities. We see quite a few patients on our program that have end-stage heart disease or other diseases of the circulatory system. Quite a few patients with dementia, particularly Alzheimer's or other diseases even of the nervous system. A lot of COPD patients or other diseases, respiratory diseases. Then we have that miscellaneous category there, which is a lot of people who maybe just have, like I mentioned, maybe multiple things going on. It's just the aging process. They're starting to really see a decline in their functional status, really become more debilitated. That's where they might fall in. Or, a lot of end stage renal diseases and other diseases that we might see that would contribute to, end of life. So Medicare, which is the governing body that regulates us, we have to follow Medicare's rules when we look to bring someone onto our hospice program. Says that in order for someone to qualify for hospice care, they need to have a prognosis, meaning that patient is likely to pass away in 6 months or less. And they also say that that criteria is based on whether or not that patient is going to follow its natural or usual course, which is a fancy way of no one really knows for sure. And that when we talk to their provider or their doctor in the community, we ask them, would you be surprised if this patient were to pass in the next 6 months? And if they're like, gee, I don't really know for sure, but I wouldn't be surprised, then they might be ready for the services that we provide and can offer through our interdisciplinary team. So that's a good segue to what that interdisciplinary team looks like. Okay, so I just want to walk you through, but before I do, I can't emphasize enough what you see there at the center and at the core is the patient and family or loved ones, caregivers. Again, they're a part of the team. They're considered an important part of the team. I also like to start out sort of at 12 o'clock up there at the top with that orange circle, the patient's primary physician. Because I mentioned also earlier in the previous slide, that's the person that we're going to go to, their caregiver, their primary care provider or specialty care provider, whoever is overseeing their care in the community, to reach out to him or her and see, would you be surprised if? Because we still very much are actively engaged there, and we need to get the orders from that provider in the community that yes, indeed, we feel this patient is hospice appropriate. And we work through them still once they get admitted to hospice because they have the relationship with the patient. They have the expertise to guide us. Medicare regulates us to make sure that the patient and family have the option of electing who they want that provider, their hospice attending provider to be, to guide us from the community. So they're still there. We have our own hospice medical directors. We have 2 that are there as consultants. They help with making recommendations for how to palliate or how to manage symptoms that a patient might be experiencing, particularly at end of life. Both docs do need to certify that this patient does have a prognosis of 6 months or less, according to hospice guidelines. So we need to make sure that both are in agreement. Then we also have, each patient gets assigned the hospice primary nurse. You can see that kind of going clockwise around this circle. That's the patient's case manager. They're there once a week, overseeing the plan of care, making sure that all the patient's needs have been addressed. Another way we look at it is that nurse becomes sort of the eyes and ears for the provider from the community to, report back to him or her, how well the patient's doing and giving recommendations on adjustments we might need to make in that patient's plan of care to properly address those needs, again, to promote that patient's comfort. We can also provide hospice home health aides or LPNs that are there to provide the personal care. We consider them sort of the heart and soul of our program, because for many of our patients and their caregivers, getting that extra help with providing the primary care, or personal care, is absolutely, the additional support that they need. Maybe helping with getting that patient bathed and dressed and ambulating and toileting and, helping to prepare for meals and feeding. So that's that additional support that they can really offer. And they're in the home perhaps on a more regular basis, anywhere from once a week up to 5 days a week, 6, 7, depending on the patient's need. Because we are not in the home providing the care 24/7. Our goal is to support the caregivers in the home and to supplement that care. But even though we're not in the home providing the care 24/7, as the next circle on our chart here indicates, we are available 24/7 through the on-call support that we provide. So if they did need a visit in between from a nurse, in between those weekly visits by the primary nurse, or even after hours, if the patient were to get into a situation where, the caregiver needed some help with managing symptoms, we have nurses that are always available to walk them through it over the phone and to guide them, but we also have nurses that can come visit and support them if needed. Complementary therapies. Again, the focus is on comfort. So we can provide therapies outside of, maybe some of the traditional modalities that one might think of with medications in the medical model to promote comfort. The best example I can think of is massage therapy. So we do have a licensed massage therapist on our team that can provide that type of therapy to help promote comfort to patients in the home. We've offered other things like acupuncture, pet therapy, music therapy, Reiki, whatever it might take to help promote that patient's comfort. And then other therapists that you can see there, PT, occupational therapy, speech therapy, dietitian. Again, the goal is to improve quality of life. So there are times, even though we don't provide ongoing physical therapy that's meant to be rehabilitative in nature or aggressive in nature, we can provide, a physical therapy consultation to help the family with learning how to maybe transfer a patient safely. Or to use that walker to get them to the commode. So those are the types of, one-time therapy consultations that we can provide with promoting that safe and comfortable home environment. Dietitians sometimes, to promote optimal comfort, we need to look at that patient's nutrition. Or maybe help to alleviate side effects that they might have from medications, through their diet. So that's why we might be able to, or have a need to provide those dietary consults as well. Then we also have our hospice bereavement team. We consider this I consider it one of the best kept secrets of the hospice support we provide. Because many people don't realize that whether that patient was on our program for a year, a month, a week, 1 day, our bereavement team follows that family or that patient's loved ones for a period of 13 months following the patient's death. And what I mean by that is we will reach out through telephone calls, mailings, making sure that they're, that they're doing okay, offering, support with their grief and or healing process. That can be, we do a lot of one-on-one counseling if need be. We also offer grief support in terms of support groups that are available. They're once a month. They're also open to the public. We have special camps that we've been able to provide the children in the community who've experienced a loss. Those too have been offered at no cost and free and open to the public. Now, with the last year, our support groups and our kids camps, kids bereavement camps, we've been unable to host those due to the pandemic. So we've been able to, get pretty creative there and come up with other ways to be able to provide that support to those who need it. Our bereavement monthly support groups have been held virtually online through, these types of Zoom meetings, virtual support groups. And the kids camps we've been able to put together because we can't, host those programs in person. We've been able to put together coping kits that our team has put together that we're supplying to the children in the community, and have had several requests and more requests since we've made those available, because they're just great tools for the children to utilize and have in their homes to help them through their grief and loss. And just to point out, due to the pandemic, we do realize that there have been many folks who've lost loved ones, even if they haven't lost somebody who's been able to benefit through hospice services, but have had, any other type of loss through COVID or, any other unexpected loss. We realize that, with the restrictions, that maybe they haven't been able to have their usual or normal rituals or funerals or ways that they might normally, process their grief. So we've been able to offer that free bereavement to support one-on-one, if need be, to other members of the community, even if they haven't had a hospice experience, which has been tremendously used over the last year by many members of the community. So I just wanted to remind folks that that is a service that we can offer and is available. So you can reach out to us for more information on that free bereavement support. We also offer spiritual counselors. Again, I mentioned the care we provide is mind, body, spirit. So we make sure that each one of our patients' spiritual needs have been properly addressed. And we have 2 chaplains on our staff or on our team. They take a very non-denominational approach to the spiritual care they provide, because we do honor patients' choice, and because we acknowledge that everyone defines their spirituality maybe differently. We meet patients where they're at and can, provide one-on-one counseling or link them up to other members of the faith community if they have a particular faith that they want to observe. That is something that our spiritual counselors, can provide them with, that linkage, or provide that one-on-one support as well. We also offer hospice social workers. Again, the emotional piece is so important, not only for the patient, but the loved ones. So they're there to listen and provide that additional support. Maybe there are other resources in the community that patient might need that's available to help them with what we call other psychosocial needs that might exist. They help with maybe other types of closure matters, maybe help with funeral arrangements or planning, or maybe there's some financial or legal matters that need addressing. There again, they can help link those patients and families up with those resources that are available and provide that additional support there. And then, of course, we have our hospice volunteers. Again, they're the cornerstone of our program. The list and the additional support that they can provide has been quite meaningful. There are many programs that they administer that we'll talk about in a minute. Again, some of the services that we're able to provide face-to-face through the support of our volunteers has been limited due to the pandemic, but there are still some things that they do to help support those patients and families that really provide that extra special touch or emotional support that our patients and families need and can absolutely benefit from. So that's what our interdisciplinary team looks like. Our goal is to provide that world-class care to every single patient, every single time. One of the questions that comes up in terms of the who quite often is who pays for hospice? I've mentioned in my presentation a couple of times Medicare, because majority of our patients are Medicare beneficiaries. Medicare pays for hospice at 100%. So does Medicaid, and most private insurances also have a hospice benefit. It's quite rich. So it pays 100% for not only the support of the interdisciplinary team that I've just described and reviewed with you, so all the services that team provides, their Medicare benefit under the hospice Medicare benefit and Medicaid and most private insurances also covers any of the medications that the patient may need to promote comfort and that are related to their terminal condition, any equipment that they might need, again, with the focus of helping to address quality of life. Maybe they need a hospital bed or a walker, a bedside commode, a bedside table, wheelchair, oxygen, a lift, all of those things that are help to keep patients comfortable and at home are 100% covered under the Medicare and your hospice benefits. Again, anything that's related to their reason for being on hospice that are needed to promote comfort are covered under the hospice benefit. So that's the good news. Because Medicare pays for all of this. All of this is considered sort of the basics of hospice care. Okay. But we at Helios Care like to go beyond some of the basics and sort of be able to not only go above and beyond, but like I mentioned earlier, sort of extend our reach to those who maybe need that additional support and need help with promoting their comfort and quality of life, but maybe they're not quite ready for hospice. And this is where our palliative care program comes into play. I mentioned earlier, Medicare mandates hospice eligibility as someone who would have a prognosis of 6 months or less, or their providers wouldn't be surprised if they were to pass in the next 6 months, as long as the disease follows its usual course or natural course, which is a fancy way for actually saying that their goal at this point is purely on comfort and quality of life, that hospice patients are no longer seeking any type of care that would be considered more aggressive or curative in nature, that the only care we're providing at this point is purely for comfort purposes only. We all know that there are plenty of folks out there who are dealing with a serious illness who A, may not be in that window of 6 months or less, or B, might not be quite ready to give up treatments that are considered more aggressive in nature or disease directed, or maybe aimed at either curing their disease or just aimed at addressing their disease. You know, the best examples one might think of is, I can think of is, you know, cancer patients who are still undergoing chemotherapy, or renal disease patients who might still be receiving dialysis. You know, those are two of the most obvious examples that one might think of. But we know that those patients still struggle with a lot of the symptoms. They're struggling physically, maybe emotionally, because they're dealing with a serious disease, or, you know, have a lot of other, maybe under some spiritual distress. And we wanted to find a way to be able to help those patients too. The problem is, and this slide here shows you sort of the disease process on a continuum of care, that from diagnosis all the way through death, how we are trying to provide that additional support to folks who are looking to age in place or to remain in their home setting for as long as possible throughout this continuum of care, which is why we're trying to bring services to folks. If you look at the bottom of the screen there in those boxes, to be able to round out the home care services that they're receiving by adding palliative care to that, or more services in the home setting. Why are we doing this? And just a quick recap of what palliative care is. Palliative care, like hospice, is again focusing on that whole person and addressing symptoms that might be interfering with comfort and quality of life, both physically, emotionally, spiritually. And a big part of palliative care, like I mentioned with hospice, is there again, having those goals of care conversations, empowering patients, making sure that they have the knowledge about what choices are available to them as they might progress in their disease. Helping with planning. Advanced care planning is a big part of what we do with palliative care. Maybe helping them complete advanced directives. Just really finding out what the patient wants most or fears the most. As I mentioned, this is a big part of what we do for hospice. All hospice patients get very highly specialized palliative care. That's what we do. Our palliative care program is a way to extend our reach to those people who are dealing with a serious illness earlier. And this slide here shows you why we want to do that. Because there have been lots of medical studies that have been conducted that suggest that the sooner that we can introduce palliative care in the course of the person's illness, the better the outcome for the patient and the family. It's kind of a no-brainer if you think about it in terms of the patient. Obviously, the sooner that we can address their pain, their shortness of breath, their nausea, their vomiting, their constipation, their anxiety, their restlessness, their sleeplessness, all of those things that can go hand in hand with a serious illness, the better the patient will feel. They'll feel better sooner. They'll live better sooner. Sometimes they actually can live longer, and there have been studies that have suggested that as well. They did, the most famous study was a study with cancer patients who started their cancer treatments upon diagnosis. Breast cancer patients started getting, their usual chemo, radiation. There was a group that had that, and then there was a group that had those alongside of really good palliative care at the same time. Those patients who received the palliative care along with their treatments for their cancers had lived almost 3 months longer than those who had not. The family also tends to have better outcomes if we're able to provide palliative care sooner. Because our goal is empowering them with the knowledge and helping patients understand their disease process, that provides a lot of reassurance to family members too, when they kind of know what's usual, what's not usual, what to expect. Again, it helps them feel better in better control as caregivers, which not only helps them have greater satisfaction with their care, but helps them in the long run with the bereavement and their healing, their grief process. The challenge has been that at this point, not yet, but hopefully in the near future, Medicare doesn't quite yet pay for palliative care unless the patient qualifies for hospice. So we at Helios Care have been able to come up with other options to be able to provide palliative care to folks who need it, who might not quite be ready for hospice. One is that they can pay for these services privately. It works like a fee for service. So you pay per visit. And it's on a fee scale based on the discipline or type of clinician that's in the home. So it's one amount for the RN visit. You can pay separately for the home health aide visit, the social work visit. They still have on-call support available to them, which is, a source of comfort for many of these patients, knowing that they have somebody else to call if they ever have any questions after hours or need someone to come out and visit. And there again, if that visit is needed, they just pay on a per visit basis. It's not a great option for some folks because we do understand that many folks who need palliative care may have limited means to pay for those out of pocket. The good news is we've been able to obtain special funding through a private foundation out of New York that's been able to fund another program that we've made available called Choices. And this program, like I said, is because it's grant funded, is at no cost to the patients who might qualify for this program. And the qualification is someone who's had maybe frequent trips to the emergency room or hospital within the last 6 months. Because there again, the goal here is to keep patients comfortable and at home. And our funder has recognized through our previous experience through successful palliative care programs that indeed, if we can provide that additional support to folks, we have been able to keep them or prevent them from an unavoidable trip to the emergency room or hospital. So because of that, we are now able to offer this Choices program to folks who may have had those visits to the hospital in the last 6 months at no cost to the patient. So those are our palliative care programs options we have right now. I mentioned already complementary therapies, massage. This is, pet therapies that we've been able to offer. I already walked you through some of the bereavement supports that we provide. What I would suggest is if you know of somebody who's had a loss, who is struggling, please reach out to us and we can get you connected to be able to access those support groups. Again, they're done virtually now through Zooms, or hook that person up with the one-on-one counseling. And because we don't have those kids camps right now, we can give you information on how to get those coping kits that we've developed for the children in our community. I'm going to give you at the end of this session our phone number and access to our website that will give you more information about those programs and how you can access them. We have our version of a sort of a perfect wish program or make-a-wish program. And that really involves, you know, what would a good day look like for you? And thanks to the support of our community and the funds that we have available, we've been able to make some of those experiences happen for our hospice patients. We've, you know, been able to take them out, well, not during the pandemic, but, you know, in the past, take them to a special concert or, you know, a steak dinner with their loved ones, a fishing trip, a trip to the fair. We've been able to host a dance party. So there's just lots of things that we can do to give, you know, hospice patient that perfect day, or what is there, you know, there's something that they might wish for. We also have been able to pull from our special needs funds to help out patients, you know, maybe what they need to promote comfort, maybe they need an air conditioner. We don't see this come up very often, but just something to mention, because most patients either are on Medicare or Medicaid or have some form of insurance. But if for some reason they have a private insurance or no insurance, and you know they're unable to afford maybe their high deductible or copay, we've been able to work with those patients and their families so that, you know, ability to pay or inability to pay is not an issue for them gaining access to the care that they need at this most important time. So keep that in mind. We're able to work with patients and families so that income and payment is not a barrier. I mentioned some of the programs that our volunteers are able to provide that kind of go above and beyond expectations. You know, our volunteers do quite a bit with providing companionship, respite for caregivers. Again, it's been quite challenging without being able to while still trying to keep patients and families safe, as well as our volunteers safe. So, you know, having them in the home has been quite limited, but there are other things that we have been able to do even still throughout the pandemic. One being our Story Keeper program. I know Tammy Chrisman, our Director of Volunteers and Community Support, I think did a presentation back a month or a few weeks ago. If you haven't had a chance to listen into that presentation, I would encourage you to do so, because it's a wonderful program where our hospice trained volunteers or Helios Care trained volunteers can sit with a patient and get them to tell their most precious memories, their life stories that are the stories that we all cherish from our family members that get handed down from generation to generation. And they tell those stories, they get recorded in the patient's voice, digitally recorded, and put onto a CD so that they can now have that as a treasured keepsake and can hand down, like I said, from generation to generation. Our volunteers also make what we call tuck-in calls. So every Thursday they come in and make calls to patients and check in on them before the weekend's coming. How are they doing? What, you know, do they have enough medications? There's a snowstorm coming. What's your plan for snow removal? Just to make sure that they have what they need and to avoid any type of unexpected or unplanned crises over the weekend if avoidable, but really just to kind of give that extra phone call contact for these patients, and just knowing, and they start to develop a relationship and rapport with their tuck-in volunteers and appreciate, you know, having that interaction on a regular basis. We also have our Sunshine Flower program where, you know, maybe funeral homes that have flowers that then become donated from the families who may not want to bring those extra flowers home, or the family doesn't want to keep them, they might donate them back to us. We have our volunteers who will rearrange them into little pick-me-up bouquets, and then our volunteers will deliver them to our patient's home, just because, with a little note, just thinking of you, just wanted to brighten your day, whatever. It's just because. So that can be an unexpected but greatly appreciated surprise to get these flowers just because we're thinking of them. And then we also have our Veterans Appreciation Program. We are a We Honor Veterans partner with our state and national hospice organization in partnership with the VA, where we can show our patients who have made those sacrifices to serve our country. It's a very small token of appreciation, where if they have made those sacrifices and served in any branch of the military, we present to them a certificate and a pin as a small token of thanks. And unfortunately, for many of our men and women who have served, this may have been the only formal recognition or form of appreciation that they've received. And it's greatly appreciated not only by the patient, but oftentimes by their family and loved ones. And we do it with this small little certificate ceremony. Often we have many volunteers who are veterans themselves, who like to present those certificates. And it's just, again, another opportunity for them to have that camaraderie interaction with somebody who can listen and understand and, talk to them about their experiences. And then finally, I mentioned earlier, a big part of what we do with our palliative care programs is helping with developing a plan, helping advocate for our patients and their wishes at the end of life on the type of care they would want or not want. So we help them with having those goals of care and help them with completing their advanced directives. Because we feel this is so important for all members of our community, we do offer that as a service. So keep that in mind too. Because for many reasons. One, none of us really ever know when we are in a position, we might find ourselves suddenly in a position where we can't speak for ourselves. And so we want to make sure that we have someone identified to be our decision maker in the event that we cannot speak for ourselves. And we want to make sure that that is a person that we are confident that will be able to honor our wishes. So therefore, in order to be able to properly advocate for what we would want or not want, and making sure that our wishes are honored, it's very important that we have those outlined and advanced through what we call an advanced directive document in the forms of a living will. Our favorite tool to outline a healthcare proxy in a living will is what you see here, which is called our 5 Wishes document. We also have another program that I would encourage you to watch if you haven't already, that talks a little bit more about advanced care planning, and in particular our favorite tool, which is this 5 Wishes document. There again, we consider this a service that we can provide to our community. So we provide this tool at no cost, and if needed, the additional support to complete the document. So there again, if you go on our website or if you call us, we can send you the form, we can make that document available to you, and or help you with completing it if it's needed. So that is something that's out there that I would suggest. If you haven't listened to the program, you can access it through Alicia's website through the Office for the Aging or directly through our website, the Helios Care website, which I'll share with you. So before I get to the end, what I would like to just emphasize for you is I already mentioned how we can all help members of the community or those that we might know who are dealing with a serious illness by encouraging them to have those conversations, encouraging them to maybe complete their advanced directives and letting them know that there's this great tool out there that they can get help with called 5 Wishes. The other piece to remember, this is important, that anybody can make a referral to Helios Care. Anybody can reach out to us to make that initial phone call. So often we hear and learn that sometimes there could be a delay in the process. Maybe they're waiting for their doctor to bring it up, or maybe they're waiting for, the paperwork to get processed. And we all know sometimes that can take days, sometimes weeks. If you're really not sure how to begin, we say just call us and we can help with initiating that process and reaching out. And what I'm going to share with you here is sort of the when. When is it time to reach out to Helios Care? How will I know if I or my loved one or my friend might benefit from hospice or palliative care? So this shows you some of the things that might trigger you to think about, give us a call. One would be maybe you know somebody who has a life-limiting disease, like we showed you on that pie chart. And they're simply not getting better. Despite continuing treatments, they're just continuing to decline. Or maybe they're in and out of the hospital or emergency room. As I mentioned before, if they're a frequent utilizer, they might be eligible for palliative care through our Choices program that would be of no cost to them if they're not ready for hospice. Maybe they're losing weight and you just can't explain why. There's no appetite. Maybe they have reoccurring infections or non-healing wounds. Overall declining performance. Maybe there's someone who is relying more and more on others for their activities of daily living. Maybe they were able to, dress and bathe themselves independently before, but now they're needing more help with that. So those are some things that might say, maybe we should look to get some more support in the home. Or just overall poor quality of life. Again, if you're not sure, because our emphasis is on education and empowering our patients and families, we always say to folks, it's never too early to educate yourself. Even if you're not sure, or you're not sure when, even if you know for sure that it could be weeks, months down the road that you think you might be in need of this type of care in a home setting. It's never too early to start the ball rolling, as we say, or to start gathering your information ahead of time. So we're happy to give you that information if you call us. We would be happy to do informational visits in a home setting. We know these sometimes can be big decisions that might involve other family members, other caregivers. So we're very happy to send one of our team members out to visit in a home and have this kind of informational session with others who might need to be involved in that decision, and walk everyone through what options are out there and give you that information in a home environment, because that's where most people are most comfortable. We get that. So there again, this is the number you can call us at any time for more information. I mentioned another great source of information is go directly to our website, which is the www.helioscare.org, which there's lots of great links and information out on that website as well. So that wraps up the presentation itself.
Does anyone have any questions?
I know it's a lot of information, which is why I mentioned we're very much happy to come meet with anybody who would like to get this information one-on-one.
Great. Well, we don't have any questions, so I guess that's it for today. Thank you so much for presenting for us.
You're welcome.
Have a great afternoon, everybody.
Bye-bye.